Hello and welcome. And here's my cat. I'll do the tail wiggle, even though she definitely dropped in front of the camera right there. You do. Anyway, so today we're going to be talking about rats and tumors because I've been seeing it crop up a little bit, and I just feel like new rat owners don't really necessarily understand what they're getting into when they get rats when it comes to tumors. So we're going to talk about it. Let's get into it. So if you've been on my channel for a while, you've heard me say many times that you're not going to escape health issues with your rats. And one of the most common is some type of tumor. The most common tumor being mammary tumors. So the thing with mammary gland tumors is it can happen in males or females. They're usually benign growths that happen along the mammary line. So it's typically like under the armpits, down the stomach, or in the crevices of their legs. Sometimes they can appear on the sides as well. I've had a vet say that they just assume any lump they get in is going to be a mammary tumor unless it looks odd upon removal, because rats have so much mammary tissue. Which also means that unlike with other animals, a lot of times if like your cat or your dog gets a mammary tumor, they will remove that mammary gland to try and prevent other tumors. But with rats, there's so much mammary tissue that that's just not really a possibility. So they typically will just remove the tumor and hopefully the rat won't develop another one. And the thing with mammary gland tumors is sometimes they can be treated with a medicine called cabergoline as well. However, that's also expensive and it doesn't remove the tumor. It just like slows down the growth basically because it affects the hormones that produce those types of tumors. But it is not always a guarantee, even if a tumor is in the mammary line. Even if a tumor is in the mammary line, it doesn't necessarily mean it is going to be a mammary tumor. So typically I will opt to remove mammary tumors. Now, rats can also get malignant tumors. Mammary tumors are generally benign, but they can also get malignant tumors. And these do act a bit different from mammary gland tumors. So typically, in my experience, cancerous tumors, malignant tumors are going to feel lumpy. They typically grow really, really fast and they feel different. So some people say that they feel harder, and mammary tumors will have a little bit of squish to them, but they're still firm. But cancerous tumors can feel harder. They can be discolored, especially if like they're a dark color, like a black color. That's typically what I see with my rats and their malignant tumors, and they feel lumpy. So I had a rat named Merritt, and she developed one on her thigh, and the best way I could describe it to people was it felt like a sack full of marbles because it was so lumpy and weird. And they typically grow very, very, very fast. So while mammary tumors my rats have had them for like up to 6-7 months before they started to become a problem. Now they can also grow a lot faster. Sometimes they become a problem within a month. But a lot of times they grow a little bit slower, whereas with malignant tumors, in my experience, they grow extremely fast, like doubling in size within like a couple of days sometimes. My friend Kendra had a rat named Artemis, and she had a malignant tumor in her armpit, and she got it removed because she thought it was a mammary tumor. And then it came back extremely aggressive, and within 2 weeks it had completely taken over her arm and she had to be euthanized. So that's kind of what malignant tumors can do. So like with Merritt, with her malignant tumor, I got it removed in June, and it came back in July, and she was gone partway through August. So that's how quickly they can grow. They just grow really, really fast. Sunny, who's a rat you guys might remember, she developed a malignant tumor on her chest. It might have also been like up under her ribs, possibly shooting out from her lungs because she had a lot of breathing issues. And it grew extraordinarily fast as well. But the worst case I have is probably my rat Curtains. So the thing with Curtains, she was 1.5 years old when she passed away. And basically while doing health checks, I saw that her neck looked a little funny. And so I pet her neck, and I found a hard lump. And I was like, that's really odd. Maybe it's an abscess. Neck abscesses are very common. And then over the course of, I'm going to say 5 days, I can look back and see the exact dates, but it was under 2 weeks from when I spotted it to when it had completely taken over the side of her neck. and the other side of her neck as well. And I had to put her to sleep because it had metastasized and it had invaded her brainstem as well. And she was having severe neurological issues. So like, and it was less than 2 weeks for her from when I found it to when she was gone. I think it might have been a week. So like, that's the thing with malignant tumors. Now, other tumors they can get that are also cancerous, but like it's a different kind than like what you'd find on their like mammary line. There's something called Zimbel's gland tumors. And those appear like using... Can I use you for a second? Do you want to be my assistant? She's like, I don't know about this, man. Okay. These appear like up here around the ears. So like where my fingers are, that's where you want to check for Zimbel's gland tumors. And Zimbel's gland tumors, here you go, baby. Now, Zimbel's gland tumors happen on the Zimbel's gland, obviously. And they are usually very hard, bony nodules that when you first feel them, and they can go extremely fast. They tend to grow a little bit slower with dwarfs. Dwarfs usually have about a month before they become a problem and they need to be euthanized due to the tumor. Whereas with standards, I've seen it happen within 2 days. My friend Kendra had one, and she sent me a picture of her saying this wasn't there this morning and it was a huge lump. And the next day she had to put the rat to sleep because it had started to push her teeth out of alignment that quickly. So Zimbel's gland tumors are extremely aggressive and extremely fast growing and extremely invasive. So some people do attempt to remove them. The issue with this is because they're so aggressive, removing them just makes them worse. They just come back faster because you can't necessarily remove all the cancer cells that are in there because it's such a difficult spot. And doing the surgery is very painful for the rat. It's a very sensitive spot. It can break their jawbone, which is extremely excruciatingly painful, both during surgery or if it's left too long. So the thing with Zimbel's gland tumors is most experienced rat owners will tell you to just like keep them comfortable, put them on pain management immediately, and just keep them comfortable for as long as they can. If you notice their teeth are starting to be pushed out of alignment, that means it is time to put them to sleep. Or if you notice that the tumor's getting a little bit large, then it's time to put them to sleep. You don't want the tumor to rupture, for sure. That is excruciatingly painful for the rat. And the thing with that is sometimes they will get also tooth root abscesses, and people think that that's what the cause is, but it's a Zimbel's gland tumor causing the abscess. So anytime you see your rat that has a tooth root abscess, any swelling in the face, any swelling anywhere in the face, that is an immediate vet visit as soon as you can get them in, because that is very, very serious, especially with things like tooth root abscesses that can start affecting the eyes. Sometimes the eyes are unfortunate casualties of these issues. So any swelling in the face whatsoever, to the vet immediately. Now, the last two tumors I'm going to talk about before I get into discussions of like preventatives will be one, pituitary tumors. Pituitary tumors are tumors that grow in the pituitary gland of your rat. And there's a lot of different kinds that can appear there, but there's one specific kind that can be treated with cabergoline and can be maintained. Your rat can have a normal lifespan on cabergoline. However, the thing with cabergoline is it's A, expensive, B, in the States, depending on where you live, it can be hard to get, and C, it is not a guarantee. It takes a long time to work. So keep all those factors in mind if you start to notice an issue with your rat that could be a pituitary gland tumor. And the symptoms of a pituitary gland tumor are unfortunately very similar to the symptoms of other neurological issues, such as strokes. So it's ataxia, and that's when they can't use their hands or their arms, and sometimes they'll cross their arms. And it's also changes in personality. So if you have a rat that's not very affectionate and they suddenly become affectionate, that can be a symptom. Or if you have a rat that's not normally aggressive and they suddenly become aggressive, that can be a symptom. General lethargy can be a symptom. Mouthiness can be a symptom. So basically, if you're noticing that your rat is acting a little weird when you're handing them treats, like they're going for it, but they don't seem like themselves, that can be a symptom. It's kind of hard to explain because once you see it, you know exactly what I mean, but if you've never seen it, it's hard to explain. But they also, in my experience, they just don't quite look like themselves, like in their eyes. And I know, again, that's like a hard thing to explain, but it's like a lack of awareness almost, where they're just not quite there. Another symptom of pituitary gland tumors in females that is less common, but still a good one to note, is if you have an older female who's never been around a male and she starts lactating, the pituitary gland affects hormones. So if she starts lactating, that is a symptom that there is something causing something to go wrong with her hormones. That can be a symptom of a pituitary gland tumor. Now, telling the difference between a pituitary gland tumor and a stroke can be difficult. So one symptom that is a symptom of stroke but not a pituitary gland tumor is choking. So if you notice that your rat is having some of these other symptoms and they're choking, that could indicate stroke. Breathing problems are also an indication of stroke. If they're suddenly like fast breathing, that can mean that they had a stroke. And then another thing that is more common with strokes, if you find them shortly after, is sometimes you can notice that their eyes aren't dilated the same way. And sometimes they'll be paralyzed on one side with a stroke. That I don't find as common, but it can happen. A lot of times it's like their back legs stop working suddenly. But that unfortunately can also be a symptom of a pituitary gland tumor. So, you know, neurological symptoms, they all look the same. They can mean many different things. Now, the last thing I want to talk about with tumors is internal tumors. So the thing with these is you don't usually get a lot of warning with them. Internal tumors they just, exactly what it sounds like, they're in a tumor that grows internally. They're typically malignant, and typically, you know, they are there when your rat starts acting strange, like lethargic, hunched, in pain, possibly aggressive because they're in pain, just not themselves. And the thing with the internal tumors is that they tend to grow and attach to organs. So a lot of times they are not removable. Sometimes they are if you have a female rat, because they can get tumors in their uterus, and if caught early enough, they can just be spayed and you can just yoink it out before it attaches to any other organs and causes an issue. That is not a very common thing. Typically, if they have an internal tumor, a lot of times it's in the lungs, or it's just like a mass that you can't tell where it came from. It's just there. And yeah, that's typically a bad sign, and your rat won't usually make it, unfortunately. But sometimes you get lucky and it's just attached to like the uterus or the ovaries if you have a female, and you won't get right out. Now, a common question is how to avoid tumors with rats. And I'm going to be very blunt with you right now. You're not going to. Rats are very, very, very good at growing tumors. I get them all over the place. A lot of times when I take my rats to the vet for something I know is not a tumor, they'll still tell me, just so you know, it could be a tumor. And it's just like, yeah, I know. It's not, but I know. Because the rats have a lump, that's going to assume tumor. That's how common it is. So I've had it with tooth root abscesses, normal abscesses. Junimo here has a papilloma on her tongue that needs to be frozen off. They warned me that could be a tumor. I've seen it with like infections. Literally anytime my rat's behaving weirdly, they're just like, okay, well, this could be a pituitary tumor. I'm just like, well, it's not, but I know. But is there something you can do to lessen the chances? And kind of, but not really. And I'm sorry that that's such a vague answer, but I'll get into it. So first, diet. Diet is a huge factor. Rats that are significantly overweight do tend to develop mammary tumors a little bit easier. So you want to feed them a good diet. So if you're in the States, Oxbow is considered a good diet. I haven't fed it in years, and I don't know if the formula's changed, but it's still considered a good diet. I think it's Science Selective for like pelleted. That's another good one. I don't know much about that one. I feed the Shunamite diet, which means that it's a homemade mix, and that allows me to control the ingredients, allows me to control the fat ratio and the protein ratio and the sugar ratio to make sure that they have a decent dry mix. And then I feed them fresh food every single day as well. And that also allows me to help them have the full range of nutrients that they need. Another factor is going to be genetics. So if you get your rat from an established breeder that has like a good established reputable breeder, then you can mitigate tumors. So like I got some rats from a breeder in Arizona who's been breeding since the 90s. And one of the girls I got from her, I got 4 girls from her. One of them did develop a mammary tumor. The other 3 did not. One did unfortunately pass away from some kind of issue, which was probably a tumor in her nose, a malignant tumor, but I don't know for sure. The other 2 lived to be well over 2.5 years old, and neither of them developed a tumor, a mammary gland tumor specifically. One did pass away from a pituitary tumor, the other from heart failure. But to make it to past 2.5 years old, being intact and not really having significant health issues for the entirety of their lives is amazing, and a testament to that breeder's lineage, essentially. My friend Kendra also has rats from her, or had rats from her. They've unfortunately all passed away, and she had a very similar experience where they just kind of sailed past 2 without an issue. And her last one that passed away was like 2 years and like 9 months, 10 months old. And she did unfortunately develop some malignant tumors at the end, but still getting well past 2.5 years old without any tumors or any issues is amazing, and a testament to that breeder's work. So lineage can help. I have had rats that developed mammary tumors at as young as 10 months old. All the ones I personally dealt with like that had really poor backgrounds. They were either feeder breeders or pet store rats. That is also a testament to their lineage, is that they were so young when they developed these tumors. But you can only expect so much from the breeding of a pet store, to be honest. Another thing is, can you avoid them by getting a certain type of rat? So for example, male versus female. So you'll hear a lot that males are less prone to tumors than female rats. And they are less prone to mammary tumors. And you'll hear a lot that they're also less prone to pituitary tumors, but that is not my experience. Now, my 4 boys, none of them so far, knock on wood, have had pituitary tumors. I have 1 still. I've lost 3. None of them died from pituitary tumors. But my friend Kendra, she's had 7 male rats, and I believe 5 of them died from pituitary tumors, and they weren't even all genetically linked. It is not as uncommon as people would leave you to believe. Mammary tumors are way less common in male rats than female rats, because it is the hormones that produce them, and the female rats are going to produce those hormones at a lot higher rate than male rats, but they can still get them. And even if they're less prone to mammary tumors, they are still not going to be immune to malignant tumors. And I do see that crop up a lot. I've seen it with male rats. It's like pretty brutal, because I've seen multiple times where they get 1 tumor and the owner's like, oh, okay, I'll get this removed. And then within a couple of days, they develop like 6 or 7 more, all fast growing, and it becomes an emergency euthanasia situation. And I have seen that multiple times with rats. Unfortunately, usually just male rats. I have not seen that with female rats, but it's obviously possible in female rats as well. That's one reason a lot of people will go with males over females, is because temperament-wise, they're fine with either a female or a male with their stereotypical personalities, i.e. males are cuddly, females are crazy. If you've been here a while, you know that I think that's absolute bull, but you know, if you're new here, you don't need me to go on that rant. But hi Baker. Hey Baker boy. Hey baby. Hi. But a reason people go with males is because they are less prone to mammary tumors. But I do see them getting lung tumors. I do see them getting cancerous tumors. They get Zenbal's gland tumors, pituitary tumors. All of that is pretty much just as common with males as with females. So with females, does spaying help? And the answer is yes. Yes, it does. So I've had many spayed females. I currently have, how many spayed females do I currently have? I have 6 spayed females at the moment, but I have spayed many females, both for aggression issues, because unfortunately I'm very good at picking out the ones that are going to be aggressive, and for preventative reasons. And so with my females that have been spayed, let's talk about my ones that have passed away, because obviously my current ones, Thistle and Kelpie, are just barely over a year old. Blooper and Irving just got spayed 3 weeks ago, and then Suitor and Lamb are over 2. So there's that. But let's talk about my past ones have passed away. So let's start with Sailor. Sailor lived to be 2 years and 11 months old, and she did not develop a mammary tumor until 2 days before I put her to sleep. And then there was Humdrum. Humdrum lived to be 3 years and 2 months old, and she did not develop a mammary tumor. She did develop a mass, a malignant mass, but it was not a mammary tumor. And that was at the very end of her life, and the reason I ended up putting her to sleep. Then we had Dorothy. Dorothy lived to be 2 years and 9 months old, and she passed away from heart failure. She never got a mammary tumor. There was Ducky. Ducky lived to be 3 years and 2 months old, and she passed away from HLD, hind leg degeneration, and she did not have a mammary tumor at any point in her life. Then we had the Weather Girls. There was Cloud, who passed away at 2 years and 4 months old. She never developed a mammary tumor, and she passed away due to complications with prednisone. And then there was Foggy. Foggy lived to be 2 years and 7 months old, and she passed away from heart failure. She did not have a mammary tumor. And then there was Sunny. Sunny passed away at 2 years and 9 months old, and she had a malignant tumor, but not a mammary tumor. And for the sake of full honesty, I did have 2 other female rats that were spayed that unfortunately passed away a lot younger. There was Bug, who was 1 year and 7 months old, and she's the one who had the weird nose thing that might have been a tumor. It could have also been like a very severe tooth abscess that unfortunately made her go septic. She was having neurological issues on the day that I decided to put her to sleep. So it's possible that the infection spread either to the brainstem or her brain, and that was causing it. And it's possible that the tumor, if it was a tumor, had invaded her brainstem or was causing the neurological problems. And then there was Curtains, who I also mentioned. She died at 1.5 years due to the malignant tumors in her neck. The thing with spaying is if you do it before they have a mammary tumor, in my experience, it does significantly reduce the chances that they are going to get one. If you spay them after they've had a mammary gland tumor, again, my experience is they'll buy you a lot more time, like 7 months to 1 year, typically, before they develop another one, but they do generally develop another one. But if you spay them when they are younger, so preventatively around 6 months old, it does greatly reduce the chances that they're going to develop a mammary tumor. All the ones that I had spayed around that time have been very, very good with it. The only exception is possibly Lamb. She does have a weird lump. I don't think it's a mammary tumor because it's just not growing, and sometimes it's shrinking. It's weird. I don't know what it is. I'm just rolling with it right now. And finally, let's talk dwarfs. Dwarfs versus standards. Dwarf rats are way, way, way less likely to get mammary gland tumors than even spayed female standard size rats. The only dwarf rats I've seen that got specifically mammary gland tumors, I personally actually haven't seen any, but my friend Ashley has a lot more experience with dwarf rats. And she says the only ones she's seen, females that have gotten mammary gland tumors, are ones that have been significantly overweight for a significant portion of their life. So a few caveats there. So the thing with dwarf rats is they don't produce as much growth hormone, and so they're just less likely to develop those types of tumors. And I do mean significantly less likely. Dwarf rats are actually, it's pretty common for them to sail past 2, oftentimes sail past 2.5. Now, they're still rats, so they still get all the same other issues that rats get. They are healthier, but they can still get sick. They can still have respiratory issues. They can still develop malignant tumors, such as Zimbal's gland tumors they're particularly prone to. They can still have pituitary tumors, though it's rare. It's pretty rare. But they can still get tumors in like their lungs and internal tumors in their ears. And much like with standard rats, it is very dependent on breeding. If you have like a backyard breeder selling dwarfs and you get some, there's a good chance that they might end up with an internal tumor. I've seen several poorly bred dwarfs that ended up with an internal tumor of some kind. Now, I've had people ask me if spaying dwarfs is like a guarantee they won't get tumors, and no, that's not a guarantee. There is no guarantee because, again, these are rats we're talking about, and they're very, very good at producing tumors. And the thing with dwarfs is the tumors they're most likely to get are malignant tumors that are not dependent upon hormones. And spaying only prevents the hormonal-based tumors, or reduces the chances of them getting the hormonal-based tumors, I should say. So they can still get those malignant tumors, and they do. So while dwarf rats can live to 3 years and well beyond that even, it's not necessarily a guarantee or even likely, to be honest. I've been watching a lot of dwarf rat stuff lately, obviously, because I have a bunch of dwarf rats, and they do have like a pretty typical rat lifespan a lot of time, which is where things start to go wrong around 1.5 years. And sometimes they only live to be about 2. But there's a greater chance for them to live to 3 or beyond than standard size rats. And another thing with dwarf rats is there's not a significant difference between the health issues that females have and the health issues males have. So honestly, if you wanted to get dwarfs, and you don't care necessarily about male or female, if the medical stuff isn't that different, I think you'd have an easier time getting male because they tend to be more readily available. I have females, and believe me, it's way harder to get female dwarfs than it is to get male dwarfs. So if you're new to rats and you're just looking into getting dwarf rats of either sex, you're probably going to have a lot easier of time getting males than females. So just saying that. And again, behavioral wise and health wise, there's not that much difference between them. But yeah, I do believe that is everything. But yeah, I hope this video was helpful to you if you're wondering about tumors with rats. And yeah, if you enjoyed this video, you know what to do. All the fun stuff down below. I'll see you in the next one. Goodbye!